Hospitales. Introducción al hospital. Jordi Pons es un estudiante de medicina de cuarto año de Barcelona que vino a Gran Bretaña en un programa de asistencia clínica, o sea, de preclínica, asistencia preclínica para el Royal Infirmary Edinburgh, el Infirmary Real de Edimburgo. El doctor Barron lo está introduciendo hacia el hospital. El doctor Barron dice: el de Royal Infirmary es el nombre de la Universidad Hospital de Edimburgo, de la Universidad de Edimburgo. Es un hospital general eh, que es visitado por todo tipo de pacientes y enfermos. O sea, que brinda todo tipo a los pacientes de su enfermedad, excepto asistencia pediátrica, porque para eso tenemos un hospital especial, un especial especializado en otra parte de Edimburgo. Se llama el Hospital de los Niños Enfermos. Puedes ver algunos departamentos de nuestro hospital en la señal. Claro, hay otros, por ejemplo, en la unidad de cuidado intensivo o y, eh, UCI y el pabellón la unidad de asistencia quirúrgica o HDU. Jordi, ¿qué significa outpatient? Que es como, vamos a decir, paciente externo. Significa, doctor Barron, los outpatients son las personas que vienen al hospital a atenderse en la clínica o tener exámenes o tratamiento y regresan a su casa el mismo día. Y los inpatients o los pacientes internos están en el hospital por uno o más días. Los cuartos donde están los pacientes se llaman pabellones y los pacientes que solo requieren tratamiento de un día o una simple operación pueden ser admitidos en la unidad de cirugía de cirugía día, o sea, Unit Surgery Day. Bienvenido al Royal Infirmary. La entrada sur, parqueo de carros 6D, visitadores y equipo médico, o sea, o equipo. El centro Simpson para la salud reproductiva, ginecología, emergencias, maternidad emergencias, neonatología emergencias, departamento de pacientes externos y todos los pabellones, unidad de cirugía y endoscopía, departamento de rayo X y asistencia combinada. Los pacientes externos, outpatients, Dr. Barron, the Accident and Emergency Department, A&E, also called casualty, is where patients who are acutely ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments, OPDs. They have usually been referred to the hospital by their GP, who writes a referral letter to the consult explaining the patient problem. Los pacientes externos dice que el Departamento de Emergencia de Accidentes, o A&E, también llamado casuario, es donde los pacientes que tienen una eh, que tienen una enfermedad repentina o y con una y severa condición, vienen para tratamiento y los pacientes externos que pueden esperar son que tienen para un especialista, van a la clínica en uno de los departamentos de pacientes externos, donde usualmente son referidos al hospital, a su GP, que escribe una carta, carta de referencia para llevarlos al consultante, explicando su problema. Inpatients, Dr. Barron. The inpatient in a hospital are admitted in one of three main ways. They may be seen in one of the outpatient clinics and admitted from there. As in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill. For example, with suspected myocardial infarction, or they are seen in the A&E department when the doctor on duty working at the time arranged admission. This will happen in the case of a patient with a fractured neck or femur. For example, larger hospitals may have a segment unit where patients can be admitted temporarily while their condition is assessed. Assessed? Yes, yeah, decisions are made about their conditions and what needs to be done to help them. After treatment is complete, the patient is discharged back to the GP's care. Anyway, 9.1. Complete the table with words from A, B, and C opposite. Put the stress mark in front of the stress syllable in each word. The first one has been done for you. Verb and noun. Admit, admission, assess, assignment, discharge, discharged, operate, operation, refer, referral, treat, treatment. 9.2, make word combination using a word from each box. Look at C opposite to help you. Acutely, assessment on, referral, waiting, unit, letter, list, dirty, and ill. Acutely ill, arrestment unit, on duty, referral letter, in waiting and waiting list. 9.3, which hospital departments will be most appropriate for the following patients? Look at A, B, and C opposite to help you. A woman in a diabetic coma, intensive care unit. A patient who has had a radical prostatectomy, surgical right dependency unit. A patient who is to have a escalation removed. Day surgery unit. A man with a foreign body in his eye at emergency department with a treatment abortion, gynecology emergency. 9.4, complete the Stratford and information leaflet for patients. Look at B, A, B, and C opposite to help you. Information of patients. When you arrive at the hospital, please tell the receptionist you will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend of the treatment you are going to have. You may need to have some tests such as X-ray, which could mean going to another department, or you may be referred to the other professionals, such as physiotherapist or dietitian. You may need to revisit the clinic if staff at the clinic want to see you again. Another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either has an inpatient for you there surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's care. Hem, primary care. The National Health Service (NHS) is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is free, but there is a prescription charge for drugs and appliances, such as cervical collar, with exceptions for some patients, such as children and the elderly. Primary care is provided by general practitioners or GPs, sometimes known as family doctors, nurse, dentists, pharmacists, and opticians. GPs work is in practice of 1 to 10 practice are based in a surgery and look after the health from um, to 15,000 people in their local community. They also provide health education in areas such as smoking and diet, run clinics, give vaccinations, for example, for influenza, and may perform minor surgeries or removal of warts and moles If a patient needs a specialist care, the GP will make a referral, refer the patient to a consultant in a secondary care. Patients are normally seen on an appointment basis. Home visits are made when patients are housebound, unable to leave their homes or too ill to attend surgery. Out of hours, UUH OOH treatment from 6 p.m. to 8 a.m. It's provided by the local primary care trust, which organizes chest and GPs and local GPs to cover if someone is absent. Note, the non-surgery has three meanings. The building where GPs work, the practice has moved to the new surgery on the high street, a time when GPs see patients morning injuries from 1:30 to 12:30. The work of surgeons, the patient needs urgent surgery on a burst appendix. B, the practice team. A typical GP practice employee receptionist, they are responsible for initial patients contact, making appointments, taking requests for repeat prescription, taking message from patients and other healthcare providers, and for filling and scanning documents into patient records. The practice manager has a responsibility to finance and sometimes for it supervises reception staff, hires locums, and helps prepare the practice, the development plan, practice nurse, run asthma, diabetes, and cardiovascular disease clinic, as well as one-to-one clinics for those who wish to give up smoking. In addition, the practice staff keeps work with a number of health professionals. See Unit 8. District nurse, visit temporarily housebound patients such as recently discharged hospital patients to change dressings such as ulcer dressing. Health visitors, visit families to carry out checkups on young children, particularly under 5, to make sure they are healthy. Special attention is paid to families in need, such as those living in a poverty. They also do baby immunizations. Midwife run clinics for antenatal patients. Physiotherapists provide hands-on treatment, but also teach patient exercise they can do to improve their condition after an accident and operation. At GP's Day, Dr. Stewart's work in a practice in a small market town with 3 other family doctors. The surgery is in the center of the town and is shared by 3 practices. This is a typical working morning when she is not duty doctor, responsible for emergency and urgent problems. 8 a.m. arrived at the surgery, check the UUH email prime time, check for urgent and non-urgent message. 8:30 a.m. check emails from the health board and partners prepare to surgery. 8:30 at 10:50 a.m. Morning surgery, 10 minutes appointments, 6 pre-booked last week, dot book 48 hours ahead for bookable on the day, 10:50 to 10:55 a.m. Check with reception for message, send prescription and deal with repeat prescription. 11 to 11:20 a.m. coffee break in the conference room with college. 12, 11:20 and 11:30 check home a.m. check home visit request and divide up visit with um, um 11:30 a.m. 1 p.m. home visits. 10.1. Complete this sentence. Look at A opposite to help you. Children over 60s and people with some chronic disease do not have to pay prescription share in the UK. Patients with mobility problems may be unable to go out. They are housebound. The average GP appointment is 10 minutes long. A locum is someone who takes the place of a staff member who is on leave. Care outside working hours is known of hours treatment. 10.2. Make word combination using a word or phrase for each box. One word can be used twice. Look at A and B opposite to help you change, make, perform, refer, run, take, message, staff, visit, dressing, and minor surgery. Change dressing, make appointments, perform minor surgery, refer to a patient, run a clinic, supervise staff. 10.3, which member of a practice responsible for it? Look at the opposite to help you. Running a clinic of pregnant women, midwives, teaching a patient how to strengthen his broken leg, physiotherapist, letting the GP know that a patient can come to her appointment, receptionist, running a clinic for people who want to lose weight, practice nurse, visit a patient who has just returned home after a hernia operation, district nurse, carrying out checkups on children in poor neighborhood, health visitors, organizing cover for a absent doctor, practice manager. 10.4, completed diary for Dr. Stewart afternoon look A and C opposite to help you. 2 p.m. practice team meeting over sandwich lunch. 2 and 4 p.m. afternoon surgery. 12, 10 minutes appointments. At 4 to 4:20 p.m. coffee break. 4:20 5 p.m. check with reception for message, deal with home visit, and repeat prescription request. 5 to 6 p.m. Uh, paperwork, edge referrals to secondary care, admin takes telephone calls to patients, private medical examinations, to 6 p.m. phones switched to OOH service. Medical Education 1. Medical education in the UK. Medical education in the UK. Medical education in the UK covers undergraduate education, 4 or 5 years, and medical school, the section of a university responsible for medical education. Educación médica en el Reino Unido. La educación médica en el Reino Unido cubre educación de antegrado, 4 a 5 años de la Escuela de Medicina. Es la sección de la universidad responsable de la educación médica. A 2-year foundation program which provides training for a new doctor after graduation through a series of placement in different specialties. See Unit 12. La fundación de programa de 2 años provee entrenamiento para nuevos doctores después de la graduación a través de una serie de posicionamiento en diferentes especialidades. Postgrade training which doctor take to become GPs or consultants, senior specialists, often delivered through college for different specialties, for example, the Royal College of Physicians. El entrenamiento de posgrado hace que los doctores que toman los doctores que se van a convertir en consultores o a menudo van a diferentes colegios de diferentes especialidades, por ejemplo, el Colegio Real de Doctores. Continuing professional development in the form of course and seminars which doctors undertake throughout their working lives to keep on date. B. Stratford and undergrad prospectus. The MPCHB, Bachelor of Medicine, Bachelor of Surgery, is a 5-year undergrad medical degree course. Most of your learning takes place in small groups. The main components are core, years 1 to 3, an integral program of clinical and scientific topics mainly present through problem-based learning (PBL) when you work with others on a series of care problems. Vocational studies and clinical skill, this component prepares you for the clinical skill required to contact with patients from 1 year for year one of your course through periods of practical training where you are attached to a hospital department of general practice. Student select modules or SSMS allow you to choose from a menu of subjects such as sport medicine or every study language or are prepared as preparation for a overseas elected in a hospital attachment of your one choice between years 4 and 5. Clinical attachment years 4 and 5, a series of for which clinical attachment in medicine, surgery, psychological medicine, child health, obstetric, and gynecology, and general practice. A student's view. Helen, a medical student, described her course. I'm just finishing my first year of medicine. What I like about this course is that you are involved with patients from very beginning, from the even in our first years, we spend time in hospital. Much of the course is PBL. We have 2 hour session a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to tackle the problem, look at books, analyze sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class taking notes for lectures to 9 to 5, but now it's mainly group work. Although we do have some lectures and seminars where we work in small groups with a tutor. I like all of it, even the dissection. We get to cut up cadavers from the second month of the course. Take with love. 11.1. Match these activities to the stage of medical education in the UK, giving in A opposite. This section cadavers undergraduate, keeping a love of surgical procedure observed and performed postgraduate, working for 4 months in accident and emergency to experience this specialty foundation program, taking a 4 week attachment in obstetric and gynecology postgraduate, taking an online course of recent developments in cardiovascular disease, continuing professional development. Complete the sentence, look at B and C opposite to help you. Just before their final year, students have the chance to take an elective in a hospital of their choice anywhere in the world. Problem-based learning contrasts with approach where each subject is taught separately. These day lectures are often interacted with regular opportunities for the student to ask questions. In clinical attachment, the student learns how to treat and manage patients. Student select modules can be topic for on-site medicine, such as an forgive language. The section of cadavers is an important part of the anatomy component. The middle school at the University of Edinburgh is one of the oldest in the UK. She is a consultant at the Royal, one of the leading pediatric hair specialties in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss topic in a small group with our lecturer. Match each of these activities to one of the components of the undergrad course described in B and C option. Julie spent 6 weeks working in a small hospital in the Himalayas, overseas elective. A group of students discussed together the possible reason for abdominal pain after meals in an obese 44-year-old male, 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 or 44-year-old male. Problem-based learning. A small group of students trace the pulmonary artery in a cadaver dissection. Otto spends a month working in a pediatric ward of the local hospital. Clinical attachment. Annie learns how to take blood of an elderly patient, clinical skills you might choose to study travel medicine in his fourth-year student select mode.